A CDC panel is meeting today to make recommendations on who should get the first doses of a COVID-19 vaccine.
And that meeting comes as the U.S. reports more than 1 million new coronavirus cases in the past week. ABC's Elizabeth Schulze reports.
With COVID hospitalizations at another all-time high, a critical meeting today to determine who could get a vaccine first. Former CDC Director Tom Frieden says an independent advisory panel will consider 3 factors.
One is, how much good are you going to do? How many lives are you going to save? Second is, what's fair? What's the fair way to do it? And the third is, how can we do this openly, transparently, so that there's no backroom deals?
States and large cities will ultimately be in charge of distributing the vaccine and deciding who gets the first doses. Healthcare workers and seniors with underlying conditions are expected to be top priority, while officials say the vaccine should be available to most Americans by next summer.
I would like to see the overwhelming majority of the country vaccinated before we get to the end of the second quarter.
But until then, frontline workers are making a desperate plea to Americans to wear masks and avoid gatherings as hospitals fill up with COVID patients.
Our COVID beds are filled and our non-COVID beds are filled as well. Our hospitals can no longer safely take care of the patients, any more patients coming in.
The COVID Tracking Project reports there are nearly 100,000 Americans currently hospitalized with COVID-19, a new record, while infection rates doubled from October to November. And as states fear another surge in cases after the Thanksgiving holiday, New York Governor Andrew Cuomo is asking healthcare workers to come out of retirement.
Every hospital has to identify retired nurses and doctors now. We're already experiencing staff shortages.
Drug maker Pfizer has already started moving shipments of its COVID-19 vaccine to a storage facility in Michigan so it can be prepared to ship the doses out as soon as it gets approval from the FDA. That approval is expected to come in the next few weeks. Elizabeth Schulze, ABC News, New York.